Okay, everybody, we're going to get started. Good morning, everybody. Sorry for being a couple of minutes late. We were just going through a little bit of changes on the screens. So, welcome everybody to Cognitive Health and Dementia Medications and Their Side Effects. Today, I'm going to be the host, but the co-host is going to be Michael Khalil, and I'm going to introduce you to him. He graduated from University of Toronto's Pharmacy School in 2009 and bought Sparkle Pharmacy in 2017. With a passion for personalized care and community well-being, Michael specializes in offering expert advice on medications, health maintenance, and wellness solutions tailored to each patient's unique needs. Known for his friendly demeanor and attention to detail, Michael and his team are committed to helping individuals lead healthier, happier lives. Sparkle Pharmacy was also the proud recipient of the Aurora Chamber of Commerce Business Excellent Award Health in 2023. So let's all welcome Michael. He's going to take over and we are going to start the presentation.
Hi, everyone. I assume you can all hear me okay?
Yes.
And I assume you can see, you should mainly see like the Sparkle PowerPoint type of presentation.
Yes.
For today, my goal is obviously to share as much information about, cognitive health and dementia. With that said, I'm going to talk about cognitive health and dementia as a whole. Okay. Um, by all means, interrupt if you have something personal to share or ask. It really helps because most of the times what you're sharing, someone else has been through. So it really helps us to get into it. So I try to do these presentations for the most part so that it just gives us a point of conversation and we'll go from there. Um, I gather from the ladies that most of the attendees are caregivers. So you have a parent or a loved one with cognitive impairment or dementia. Either it's starting or you're, in the thick of it. And I would certainly say this is, something that's very hard to deal with within a family and can really change the quality of life of not just the person going through it, but it can really change the quality of life of, all the surrounding family members. I just changed how I was viewing my screen. Can everyone still see the presentation okay? Will this work here? Or did I
Yes.
mess? Yeah, I'm just trying to change something so I can see everyone's faces and I'll just go with this. Okay, that's fine. So today we're talking about cognitive health and dementia medications. Okay, a little introduction is cognitive health is all about how we think, learn, and remember. It's our ability to pay attention, make decisions, recall information, and solve everyday problems. With a simple sentence like that, I think everyone thinks of the more complex things that we do in life when it comes to our brain and thinking. And it's kind of crazy to say, but there are moments where somebody can't figure out how to open the fridge door, and we can't even contemplate that that's something someone could struggle with because it's so basic. You know what I mean? So you could have instructions for a family member that says, get a yogurt and a spoon and eat breakfast. And like you find out that they were confused. And it's so hard to really imagine that because we just assume certain basics and you assume that a complicated task is more like doing laundry or more like doing something a bit more complex. So it's good to remember that, when your brain is not working the way we assume it to work, everything can get more complicated. Okay. Memory, a key part of cognition, helps us carry out daily tasks, maintain relationships, and stay independent. Memory does not just, there's long-term memory, there's short-term memory, and there's what I call, let's call it daily memory. So long-term memory is often, Did you have something you want to say, Hillary? Okay. So, obviously the long-term memory is memory about family members and things that have happened in the past and your family names and things like that. Short-term memory could be more related to what you did yesterday, the results of an appointment, things like that. But your daily functional memory includes how to open a fridge, how to do basic tasks. These are things that, you learned at some point, and when we're not affected in our brains, it's easy to forget that we remember how to do everything that we do. I haven't done one of these presentations online for 6 months or a year, so I kind of remembered. And, I kind of describe it as it's like I'm digging through my brain to find out where I put that note on how to do a Zoom call. So it's in there somewhere. And what we'll talk about later is when you have dementia, um, it's kind of like the file is lost. There's too much in your brain that you can't quite find it, you know? Um, sorry, I just changed something. Sorry, guys. It's messing me up. Got it. Um, yeah, so sometimes memory, you've saved a file. I think we've all done that before. Saved something in your house. You said, I'm going to put it in this perfect spot, but now it's been too long and you forget where it is. So you dig around the house and you try to find things. When you have dementia, it's kind of like there's too much clutter in your house, and it's harder and harder to find what it is exactly that you're looking for. Okay. Um, so that's why I said, memory, a key part of cognition, helps us carry out daily tasks. Cognitive health and memory changes as we grow, and medications and supplements can help prevent or slow down some of these issues. So I'll talk about supplements later. For the most part, I'll give you a little hint, which is vitamins and supplements, exercise. These things help to prevent. They're really good at helping preventing impairment. But unfortunately, once that impairment is already happening, there's less we can do to reverse it or stop it, but we can slow it down. So today we want to understand the impact of common prescriptions as well, and learning how lifestyle choices like sleep, nutrition, and mental activity support cognitive health. So the definition of cognitive health refers to our ability to think, learn, and remember. That's basically what our brain is doing. That even includes your brain tells your body to breathe. Your brain tells your body how to swallow. So sometimes in the very later stages of memory impairment, people start to get swallowing issues, eating issues. We need to change the thickness of certain liquids or medications because your body has started to stop sending those messages. Okay. Um, the importance of this is it's essential for everything we do in our life and our quality of life. It affects our decision making, our relationships, and overall well-being. When you have memory impairment or cognitive issues, this is where you find you could be getting frustrated over something that seems simple, or you could notice agitation with a loved one. Common brain conditions that sort of include all this. So there's the main one that we are usually talking about, which is Alzheimer's. This is the most common cause of dementia. So it's good to remember that dementia is like an umbrella. And underneath that umbrella, there's Alzheimer's, there's Parkinson's, Huntington's, and delirium. Okay. So Alzheimer's is the most common, and there's a buildup of proteins in the brain that cause brain cells to die over time and shrink. So this is where I like to describe Alzheimer's as it's like the brain is very busy and there's things going on, but some of the active things that we need to do our daily functions are not there anymore. Then you've got Parkinson's disease. This is more of a movement disorder of the nervous system that worsens over time. Okay. You have Huntington disease, which is more the decay of nerve cells in the brain. And this decay over time affects a person's movement, mental health, and thinking ability. So it kind of becomes a disease where it affects all of the above. And then the last one is delirium, which is a serious change in mental abilities that results in confused thinking and a lack of awareness of someone's surrounding. We won't go as much into delirium today, but something as an example of delirium, if anyone here has been affected or knows somebody, for instance, when seniors sometimes get a urinary tract infection. If anyone has ever noticed this, sometimes a senior could get a urinary tract infection. They don't know they have it, and it escalates, and all of a sudden their behavior is changing, but they don't have dementia. They don't have any of these diagnoses, but they get delirium. So an amazing thing to keep in the back of our minds as caregivers, as people that work for chats, as if we are here for ourselves, is to remember that if all of a sudden behavior is just completely out of the norm and out of whack, it's not like you are slowly going down this path. Double check with your doctor, do a very simple urine sample because sometimes it's as simple as a urinary tract infection, and basically the brain goes haywire, but you don't have dementia, and it's readily solved with antibiotics. Has anyone here ever noticed that or heard of that? Um, so it's something very scary that gets resolved luckily easily. Okay. Thanks, Paula. I like that little thumbs up floating in my screen. And Hillary, I saw that, and Jody. How do I put the chat here? There we go. Okay. So what's next? Is everyone okay so far with how I'm presenting and what we're doing here? Yeah. What is dementia? As I said before, dementia is not a single disease. It's a group. It's an umbrella. Anything affecting memory, thinking, and daily functioning. So memory loss, difficulty finding words, confusion about time or place, trouble completing familiar tasks. That's a big one that you want to, as a caregiver, remind yourself of. Okay. Changes in mood or personality. When these things start to become the norm, yeah, Jen, you're on mute if you want to.
Hey, oh my gosh, thank you so much. I
Yeah,
actually just wanted to go right back to when you were talking about the UTIs.
yeah,
Um, so obviously, yes, there's like a big change in behavior and it's acute. It comes on very typically very quickly and it's kind of
yeah.
like what's going on with this person. But um how how long before a UTI is actually like detrimental to, let's say, the kidneys or something, right? Because you need to sort of treat those things pretty quickly with
Yeah.
antibiotics before, but
I mean,
I think
usually it ends up getting caught. So the problem is that urinary infections often escalate into kidney infections. Urinary infection is 1 week of treatment, whereas a kidney infection can be 4 to 6 weeks.
and
If
how
you're
is that
dealing,
determined? Like how is that determined if it's just if it was like a UTI and then it's, let's just say, moved into like a kidney infection? Like how is that determined by urine samples or
usually by urine sample, or you would do a urine sample. The doctor would probably most likely often prescribe 1 weeks of antibiotics. Maybe they would retest. Then they might find, hey, it's not resolving. Did it move to the kidneys? Is there you know what I mean? And
yeah.
then usually if it's moved to the kidneys, all it really requires is a longer duration of therapy. So instead of 1 week, 2 weeks. If it's males, males on one part are usually asymptomatic, which means males usually don't show symptoms of a urinary infection. So it
Right.
makes males a lot more susceptible to a kidney infection or a prostate infection because it sometimes takes longer to know. Now, usually, when somebody has a bladder infection or a urinary infections, it's obvious. Hey, I'm peeing more often and it's burning. The difficulty if you have someone with dementia is sometimes they don't report things the same way.
Mhm.
So, so you're more at risk, let's say, of having a loved one that has dementia, having their urinary infection escalate into a kidney infection because they're not reporting it the same way.
Yeah, yeah, that's
So
always
if you
the
live
fear.
with them, you might be able to follow the trends that they've been going to the washroom more than normal. But if you don't live with them and they're not reporting it, it's very challenging. It's very
It
challenging because you really don't know.
it is. Now, I know that there are people, especially, I mean, not especially, but who get like recurring UTIs,
Yes,
recurring UTIs. And is that like, is there a chance for them to become like antibiotic resistant to them? Like,
it is possible if you keep taking the same antibiotic, that antibiotic stops working. Um, so it is a risk.
yeah,
Um,
scary.
but it is something that we see often as well, especially in females. Uh,
Right,
if you are happen to be talking about someone who has some memory impairment, the difficulty there is, for instance, you're not, what we say to people that get recurrent urinary infections is try to go to the bathroom as soon as you have to, right?
right.
Don't wait. But then you have somebody who's not remembering to go to the washroom as much as they have to. Or
Or
you
or
have,
or
yeah,
is
go
it
ahead.
potentially that they're forgetting to drink lots of water or whatever the case is? Like,
Also the case. So
is that
you're
a
not
contributing factor? Like not
flushing.
drinking enough water?
For sure, for
Okay.
sure, especially in someone that's recurrent. So one of the other things I would say is if you're specifically talking about a loved one that, let's say, urinary tract infections, and this is if they already have dementia more so. If you're talking about a loved one, and there's a great point I never thought of, if you're talking about a loved one that gets recurrent urinary tract infections, as a pharmacist, what I might suggest is put them on a cranberry supplement. So cranberry supplements are known to reduce the risk or reduce the incidence or reduce the severity of urinary tract infections. So because you don't live with them and it's hard to get them to drink water enough, and because they keep forgetting to go to the bathroom, I'm going to try, I would suggest a proactive defensive rule, which is okay, let's put cranberry supplements in their pill pack.
Right.
Cranberry supplements are known to make the urinary tract wall kind of like slippery, which makes it harder for bacteria to stick or adhere. Okay. So, with that said, I would definitely consider either A, cranberry or some sort of supplementation, or
Right.
B, sometimes the doctor, if it's just happening all the time and the person has
Oh,
dementia and we're not getting anywhere, then sometimes they'll put them on a low dose daily antibiotic to prevent recurrence. Okay.
wow. Okay. Thank you so much.
Yeah, no worries. I'm going to try to keep moving. But with that said, great to remember that if you know someone that their behavior has changed all of a sudden and it doesn't make sense, make sure they don't have a urinary tract infection. Okay? Or you have a senior who's kind of behaving very differently and you went to the hospital, make sure because sometimes we get tunnel vision in healthcare and we focus on the behavior and we forget to focus on the cause, which could be a urinary tract infection. But I think it's on more people, more healthcare providers' radar. Okay. What else did we changes in mood or personality? So rapid changes, always watch out for things that change rapidly. So if you have a loved one that their memory has slowly changed, we kind of know the path. But if one day they're good and one day they're not, that's a red flag. Okay? Dementia happens when brain cells become damaged and stop communicating properly. Okay? So, our body is a series of cells and they send messages through these cells, from like one cell phone to the other. It's kind of like there's a bad network connection, you know, and not all the message is getting through, just part of it. So always remember that cognitive decline can impact daily activities and emotional health, and thus often reducing quality of life. And I reiterate that that's for caregivers as much as the person going through it. I had one lady here, very hard to watch, but she was just the most bubbly lady ever. When I bought the pharmacy, she always wanted a hug. She would sing and just so playful. And by the time she started to get diagnosed with Alzheimer's, we would see her less. She would forget my name. And then before you know it, she wasn't coming in anymore. It was her husband. And then before, a year or two later, she wasn't able to live at home because the husband couldn't keep up with the work. So it can be really hard to watch, you know. And I think a lot of people are so used to, the pain of cancer, for instance, or the pain of cardiovascular events, and families don't always get the same empathy related to, cognitive impairment and dementia. But it can be very painful because it's a very slow decline for everyone involved. Either if they use incontinence product, is important to keep them clean and dry. My mom is no longer. Yeah, very good. So someone made a point that, with the urinary comments we made before, you might get incontinence pads. Well, making sure incontinence pads are changed frequently is very important. Addressing, that can help to either A, prevent infection, or if you've noticed, if you don't change an incontinence pad for too long, it could result in skin damage and an ulcer. So sometimes, applying some of the principles we would do for a baby's diaper care is the same that we would do for someone that needs incontinence care. So you would apply, for instance, a barrier to the skin so that when there is urine, it's not affecting the skin. Okay. Listening to your body. Obviously, this has to do with if it's you yourself, but often we can tell with family members. As we age, it's natural for our bodies and brains to go through some changes. However, it's important to know the difference between normal age-related changes and early warning signs of cognitive decline. So, forgetting what time your appointment is, it happens to all of us. I can imagine it happening more as we age. So I suggest to seniors, okay, let's start by writing it down. Start by putting it in a calendar, either on the wall or on your phone. You know, when that type of suggestion starts to be unmanageable, I can't remember where my calendar is, I can't remember to put it in my calendar, things like that, it could be a sign that things are escalating. Okay. So memory lapse, forgetting simple things such as appointments and names of close family members and, of close family and friends can interfere with daily life, but that's more of a memory lapse. Not remembering someone's phone number happens to all of us. However, forgetting your son or your daughter's name shouldn't really happen, right? So that can be more a significant warning sign. Changes in mood and behavior, increased confusion, anxiety, and withdrawal from activities. People start to move away, they start to shut down, they start to talk less. And sometimes that can be um, I don't know. It's kind of like my sign that the world is starting to seem potentially like a scary place to them. They don't feel comfortable with their own thoughts. Um, so making sure to maintain certain regular activities or routines can be very helpful, and can be very comforting to the patient because this is something that's familiar. And that's why often chats or, support, help for people with cognitive impairment try to build routines so that we can try to, you know, help the limited memory that is still there to be able to function with these little tasks. Listening matters because detecting symptoms early gives you an opportunity to manage symptoms, plan for the future, and have access to support. A lot of people, as a pharmacist, when I counsel them, you start to notice your memory is starting to slip a little bit, but you can tell it's from a functional perspective. So all of us are used to calling the pharmacy for refills. And I have one lady that I was warned her cognitive function is starting to go down. And one day she called for the same refill 3 times, you know? Um, so that's a big warning sign. So listening to your body, the reason I say that this is important is, let's just say you're going through something yourself. If you think you might be going through something, most people tend to avoid it. and avoid mentioning it to the doctor because you don't want to accept the truth or you don't want to be told bad news. However, when it comes to dementia or cognitive function, you really got to remember that the earlier the better. Because if it's progressing, well, I want to stop it at stage 1, not at stage 4 out of 10. I want to slow it down as early as possible, you know? So if you are a caregiver of somebody going through that, it's also a challenge because most people don't want to accept that you're saying, hey, you're starting to forget a lot, you know? Um, so in rare occurrences, what we'll do is you might say, let's say, a family member is going in to check their blood pressure. Sometimes we can get lucky and we can call the office and give the doctor a little bit of a heads up that, hey, there's something going on cognitively. Maybe you can bring it up and assess it on your own. And they will do an assessment. So the goals of dementia medication, I'm sure everyone here knows or has heard before, it's not a cure. Unfortunately, it's not a cure. It just slows or halts the progression. Okay. Um, so it slows the symptom progression. We can sometimes hopefully improve memory temporarily. So that's where I was just discussing that, we try to create these routines so that some things can be improved upon from a memory perspective, improve alertness or daily functioning, delay worsening. Obviously, response varies greatly between individuals. Here it says some people improve, some people stabilize, and some don't notice much of a change. I think a lot of that is going to be attributed to deep down in the brain. At what stage did you cause it? I mean, at what stage did you catch it? So if you catch it early, someone's likely to improve or halt or benefit from it. You catch it late, you're more likely not to see those functions. With that said, we'll talk about this later, but other lifestyle factors are really going to play a part. So that includes the use of alcohol or recreational drugs like cannabis. We're going to talk about sleep. People don't think about sleep, but sleep is where your brain recovers. So if your brain is never allowed to recover and repair, um, down the line, it could affect your cognitive function. So, yeah. So we're going to talk about this in a second. So there's two main chemicals in our brain that the medications will target. So the class 1 is called a cholinesterase inhibitor. Uh, Try and say that 5 times fast. It can be a little bit difficult. Um, Basically, what it's targeting is the first line here. It's targeting something called acetylcholine. Okay? So acetylcholine in the brain helps with memory, learning, and the communication between cells. Okay? So class 1 cholinesterase inhibitor is what this is trying to do is keep as much of the acetylcholine you have from being broken down. Okay? And keep it active in our brain. Earlier I was saying that, you've got two cells that communicate. And it's basically the space in between each cell that holds these neurotransmitters, these chemicals. Okay? So we want to keep as much acetylcholine in the brain as possible. And then on the next slide, the next class is something that we'll talk about, which is the next one. I can take a little sneak preview. So here is an NMDA receptor antagonist, which targets glutamate. So it's glutamate and it's acetylcholine that are affecting this. So the class 1 medication that most people go on is cholinesterase inhibitors. It targets acetylcholine. This is usually known as your donepezil or Aricept, rivastigmine, and galantamine. If anyone is familiar with these medications, I would say majority start with donepezil. Often, donepezil is started at a 5 milligram dose for 3 months. If it's tolerated, then we go up to 10 milligrams and we maintain at 10. Okay. Usually it's used for mild to moderate and sometimes severe. The next class that we're going to talk about, the NMDA receptor antagonist, that was the one that we usually use for severe. And sometimes we use both if it's truly severe. This class over here, it works by blocking the enzyme that breaks down acetylcholine, as I mentioned, allowing brain cells to communicate better. So there are enzymes in the body that when, acetylcholine is lying in that, we call it the synapse, the space between the cells. I don't know if this is complex, but some people like really knowing all this. It gets broken down. So this medication prevents it from breaking down. So it keeps what you have active in the synapse, which helps to complete that communication. Okay. Common side effects. So it can affect the gut. This can be nausea, vomiting, diarrhea, loss of appetite. It can affect the heart, slows your heart rate down, could cause dizziness or fainting, could cause sleep disturbances, vivid dreams or insomnia, and could cause weight loss. So most of the time, I would say that this medication, especially donepezil, which is what most people are started on, is pretty well tolerated. Okay. So the good news is it's generally well tolerated. The reason you want to watch out for some of these side effects, and that's with this medication as well with anything, is if you've got a senior who has dementia, and now all of a sudden they have these, gastrointestinal stomach issues, they're starting to not eat as much. That can cause you to become more frail. If you have one of these side effects where it causes dizziness, now you have a senior with dizziness and they're frail and you fall and you break something, you see where this escalates, you know. With that said, I basically counsel everybody, all seniors, always focus on fall prevention. I know chat sees this a lot. And for the most part, when you fall, things change. So that includes if you have cognitive impairment, that includes if you don't. But if you have a fall and you don't have any cognitive impairment, at least you go to the hospital, you focus on your recovery, you focus on physiotherapy, you can get up and do exercises and stretches. But when we have someone who has cognitive impairment, they're less likely and less capable of doing these things. So you often see that they don't recover. Um, the inverse, an unfortunate example is right now my father-in-law, who's 82, um, has had a few rounds of falls and breaking things. And his cognitive side and, his cognitive health has always been fine. However, now, after all these falls, they're starting to diagnose delirium because delirium is inflammation of the brain. Okay. And so after all these significant falls, now he's starting to have delirium. And that's more a side effect of um, what's the word I'm looking for? The trauma the body has gone through. So if you know anyone taking these medications, you know, you need to consider if their mobility has been affected. If their mobility has been affected, maybe all they need is a cane to prevent falls. Maybe they need to adjust their doses of medication. Okay. Maybe you tell the doctor and they'll switch you from donepezil to rivastigmine, and we'll see. Unfortunately, sometimes we have to experiment a little with medication. To see which one is tolerated better. Okay. The on the slide here, I highlighted certain ones in orange, which as a pharmacist or as a caregiver, if you see it, take action. Jen was mentioning urinary tract infections. Well, if this medication causes you to drink less water, causes you to be dehydrated, dehydration can either cause dizziness or headache, can worsen confusion, but it can also increase the incidence of urinary tract infections. If you have sleep disturbances. So either vivid dreams or insomnia. Talk to your healthcare professional. Sometimes all we'll say to do is switch the pill to the morning. Sometimes switching the medication to the morning is effective enough at getting rid of a side effect. Sometimes this exact same medication with a different senior, they take it in the morning and it causes drowsiness or dizziness. So then we'll mention to switch it to the evening, right? So everyone can be affected differently by medication. So sometimes you just need to see what's going on, bring it up to the doctor or the pharmacist. If it's medication related, if you're not sure, it kind of helps to talk to the pharmacist first, because usually people get more time with the pharmacist than they do with the doctor. With the doctor, you got to be in and out. So having an idea of what you think might be going on could be helpful. And if you can't get into the pharmacy, you can usually call. Okay, so that can be helpful as well. Anyone have any questions or concerns? We're doing okay for now. Anything else I want to mention? I think I'll get to that point later. So we'll keep moving for now. The second option here, I mean, the first option, actually, I'll go back to here and say is if you don't know anyone that needs this, I mean, if you know someone that needs this, these medications are generally covered by the government. So if they're on OHIP or 65 plus, these are covered. This medication here, memantine, is usually reserved for severe cases, or if somebody didn't tolerate any of the prior slide medications. That's either because of drug interactions or they tried it all and it wasn't helpful. Then you might switch to memantine. Last I checked, memantine is not covered by OHIP unless you do a special application. So what we try to remind people of here is technically memantine not covered. However, if you've tried everything on the previous slide, you can send an application to the government to say, hey, we need this drug because these drugs failed. And most of the time, if OHIP sees you failed 1, 2, 3, 4 options, then they'll authorize something like this. Okay? It's called Exceptional Access Program, EAP. So that can be very helpful because it can be stressful that while you're going through all this, now you have drug costs coming out of pocket. So that's something good to know. The way this medication works is basically too much glutamate in our brain can damage brain cells. So memantine helps protect the brain cells from this overstimulation. This medication is usually tolerated better than the previous class of medication we spoke about. So that's why it's a little bit unfortunate that it's not covered. However, also, the primary goal usually is to target that first one we talked about, acetylcholine. So that's usually why that's also the first line of therapy. Some side effects with this one: dizziness, headache, confusion, constipation, and fatigue. Compared to cholinesterase inhibitors, as I said, it's usually better tolerated. So, right now we talked about the two main medication classes that we use if we have cognitive impairment or dementia. This slide is more to talk about medications that can cause or worsen cognitive function. And the difficulty here, as many of us know, is as we get older, a lot of people have multiple comorbidities. So you don't just have dementia. You have dementia, you have a bladder issue, you've had falls, so you have pain, and it starts to get complicated because many medications cause drowsiness and confusion and memory issues. So for instance, if you know anyone that's had to take a painkiller like Tylenol 3, morphine, strong opioids, those can cause drowsiness. So two situations here is if you have someone who has dementia and needs these painkillers, then what do you do? What's more important, their cognitive function or resolving their pain? Often you don't have a choice and you have to address both. So the problem with opioids is they can worsen your cognitive function. Okay. And with that said, if you don't have cognitive impairment, long-term use and this is good for all of us to remember here, all of us, long-term use of medications that cause sedation can increase your risk of cognitive impairment. So for any of the young bloods here, or for anyone here that, doesn't have cognitive impairment, but they take a sleeping pill, or they take a medication for anxiety and it helps you sleep at night, anything that makes you drowsy, long term, can influence cognitive impairment. So that's where it can be beneficial to avoid a sleeping pill every night and maybe do some of the other lifestyle things that have been suggested to you. So sometimes people, if they've prescribed a sleeping pill, they might do things like, ooh, I only take it 2 or 3 days a week, or I only try to take half, or I try to skip it if I don't need it. So if you or anyone you know is on sleeping pills or medications that cause drowsiness, it's always good to keep it in the back of your mind that these medications do impair cognitive function, and long term that can be an issue. If anyone here is on that kind of medication, a small example that you can discuss with your physician is currently there's a medication that many people take for insomnia called Zopiclone. Zopiclone is known to have this cognitive impairment. There's a new sleeping aid in the market called Dayvigo. Dayvigo helps with sleep, but has less incidence of cognitive impairment in seniors. So you might prefer to be on Dayvigo versus Zopiclone, okay? You might prefer, if you've got pain, people scoff sometimes when the pharmacist says to avoid things, but instead of taking Tylenol 3 or morphine, which has codeine, we often suggest try to reduce your need for such heavy doses by taking basic Tylenol. At that point, they'll mention, oh, Tylenol barely does the trick. Well, Tylenol, if you take it once your pain is at 7 out of 10, 8 out of 10, it's often too late. But if you take Tylenol proactively, it helps prevent escalation of your pain, which can help prevent you from needing that Tylenol 3 or morphine pill. Okay? So sometimes you got to play a bit of defense to help reduce the need of medications. Or again, if you've got pain, you might use topical medications to help reduce the need of the big guns. Okay, always, it's good to become best friends with your pharmacy team. I really do mean that, because we can help you pivot, or we can help you reduce the dose or use non-drug options so that you can preserve the medications for when they're really needed. Other medications that affect cognitive function, dementia can also cause. Oh yeah. So I was trying to figure out where I was going with here. So earlier, Juanita, or someone was mentioning that, they knew somebody that got started on a medication called, for instance, olanzapine, or another similar medication is called quetiapine and Seroquel. So one of the difficulties with cognitive impairment, as I mentioned before, is mood disturbances. So you could have someone who has early stages of cognitive impairment, early stages of dementia. I have a patient like this. And so here are two things that happen. Number one, he has pain. So he had to go on a medication called Lyrica or pregabalin. That's a nerve-related pain medication, but that one can cause drowsiness. By the evening, he would also often be agitated. So the wife went with her husband to the doctor. John is often agitated. It's very stressful. He gets angry. He's yelling. So the doctor started one of those medications, olanzapine, quetiapine, Seroquel. Those are medications that at high doses are known to be antipsychotics, okay? But at low doses, they help with agitation. So sometimes people get a little bit worried because you go home, you look at the internet, and it says this is an antipsychotic. But for instance, quetiapine antipsychotic at doses of 500, 600, 1,000, 2,000 milligrams, whereas we use 25 milligrams, 50 milligrams sometimes to help with agitation and help with sleep. Okay. So don't worry, but ask. If you're not sure, ask. So the problem is that the ladies here were discussing that this person probably got started on that medication for agitation, but then all of a sudden their cognitive function worsened and it got worse. Why is that? Because olanzapine has agitation as a side effect, and this person already has agitation, right? So sometimes the medication that is meant to help can cause or worsen the problem because it can be a side effect as well. So antidepressants are supposed to help with anxiety, but sometimes they worsen anxiety and cause agitation. So whenever you or someone you know is starting a medication, what I remind everyone to do is, you know, take notes on the changes that occurred once you started that medication, because that will help you to figure out if it's a side effect. You know, sometimes people say, is this a side effect from the medication? And after you do a deep dive, you realize that this problem started before the medication. So that timeline doesn't make any sense because the agitation started before you started the medication. However, within a week or two of starting this medication, the agitation went crazy and it got way worse and it got violent and they started throwing things, and you know what I mean? So it's good to pay attention to those details. As I said, be very wary of sleep medications and anything that causes drowsiness, because those are the ones likely to affect cognitive health. The other thing to do is sometimes if you're starting any of these medications, go low and go slow. As we all know, physical activity and brain function go hand in hand. You know, it's a good reminder for all of us that being active helps to delay onset of cognitive impairment. You know, physical activity enhances blood flow to the brain, reduces inflammation, and supports brain cell health. Okay. So the better these two cells are able to communicate with each other, the better your brain is going to be working. Engage in regular physical activity such as walking or cycling. I'm a huge supporter of do anything. It doesn't matter what you do. Okay. Everyone has different capabilities and different limitations. Exercise doesn't mean you have to go to the gym and lift. With that being said, you know, especially for seniors, I do still remind everyone that movement matters and muscle matters. So muscle is more important for us as we age, and movement will always matter. So the reason I bring up muscle is muscle has been linked with longevity, and the more muscle you're able to maintain and keep as you get older, it really does help the body. You know, so movement increases blood flow. Exercise boosts circulation to the brain, delivering essential nutrients and oxygen needed for proper function. It can enhance mood. Physical activity releases neurotransmitters. So these neurotransmitters that we discussed, like acetylcholine and glutamate, if exercise is improving the release of these neurotransmitters, it means you're less likely to have a depletion, which means you're less likely to need medication to help with that. Okay. And it improves cognitive function. Exercise enhances memory, attention, problem solving, and executive function. And it can be protective against age-related decline. You know, everything we're trying to do now is slow down the decline as we get older. And that includes myself. Like, you know, we're all here either for ourselves or for someone else. But at the same time, we are all aging. None of us are not aging, and that's a good thing. At the pharmacy, people at the counter often say, Mike, don't get older. And I remind them that the alternative isn't much better, So I would rather get older, obviously. But with that said, um, I'd like to age in good health, right? So it's always cliche, but it's always the same thing that we remind everyone of is, what you eat is important, sleeping is important, moving is important, good relationships with other people, I'll applaud everyone because right now, just by listening to this presentation, doing something out of your norm, it has benefits. It has benefits for your brain, to take in new information. There are benefits in doing activities out of your norm. So if you always socialize with this one person, you often have the same type of dialogue, So if you're talking to a parent or you're talking to your kids, the conversation is usually the same. Hey, how's it going? How's the weather? What do you do today? Do you have an appointment? You know what I mean? But when you talk to someone new or you play cards or you do something different, it targets a different pathway within your brain, which can be very beneficial. So that's kind of what I was just discussing, social interaction, engagement, and stress management. So I do often suggest people get involved with chats. I do often suggest people get involved with the Aurora Senior Center, or if you're not from Aurora, anything in your area targeted towards senior or group or social interactions. I know sometimes the senior center here, they once a week go to like the leisure complex. They have walking teams and then they talk about things. At first, these things can seem boring or annoying, but long term, not only do they have benefits, but you also end up meeting some friends or meeting people that can impact your life. And keeping up with these interactions and engagements are very important. They stimulate the brain. They improve quality of life. Cognitive stimulation. The first point here is activities like puzzles, reading, Sudoku, coloring. It's very nice. And for instance, right now, I have two young daughters, 4 and 6, and they love to color. And most of the time when they color, I chill, It's my time to either clean or I go on my phone or I do other things. But recently in winter, we were up at a cottage together and, I was trying to be present more and trying to be off of my phone more. So I colored with them and I had a great time. I never thought I would enjoy coloring so much, but it started with it being a chore and then it got fun until they tried to color my page and I, told them to back off because, I was doing really well with what I was coloring. Um, so try new things. You never know what you're going to like or love or something that could be new. And it really does help to activate something new in your brain. Right now, similar to the coloring, but more related to my profession, is at Sparkle Pharmacy, for instance, we've built a compounding lab recently. If anyone here doesn't know about compounding is when we make a medication from scratch. And the reason I bring this up is for two reasons. Number one, it's one of the first times excuse me, sorry. It's one of the first times I've really been challenged for a while. It's something new, it's something difficult. I have to learn new skills. I have to talk to people. I have to read new things. And my brain has been on fire lately in a good way because it's like active. So doing new things can be great. The other reason compounding can be great for this session is, for instance, if you know somebody who needs medication for pain, but that medication causes drowsiness, which is worsening their cognitive function. Compounding, for instance, is an opportunity where I could make you a cream that helps with pain so that you can avoid taking a medication by mouth. So most people, for instance, have tried Voltaren over the counter. Voltaren over the counter is diclofenac. It's an anti-inflammatory, 1 or 2%. Often people, if they have severe pain, will say that Voltaren hasn't helped them enough. Well, the next step often is you go to your doctor and then they give you a stronger painkiller, or they give you a nerve medication. That nerve medication can also cause drowsiness, like I mentioned before, Lyrica or pregabalin. Whereas if I compound it for you, it won't have those same side effects. So once you start dealing with multiple different disease states, um, having a good relationship with your pharmacy team or your physician can help to pivot so that you get less drug interactions or less adverse effects from medications. In terms of stress management, it's also good relaxation techniques, learning how to meditate or use different things available in society like the Calm app or different things like that allow you to reduce stress naturally, which help you prevent needing the help of medication. So while I like to joke as a pharmacist that I push pills all day, at Sparkle, and if you've got a good pharmacist and a good team, they're not trying to push pills on you. They're just trying to get you well by any means necessary. And I do often suggest we start with non-medication related options. The role of sleep and rest, sleep's impact. Sleep helps clear abnormal proteins. So, we did discuss that in Parkinson's, there is a buildup of proteins in the brain. I kind of like to think of it as excessive traffic. Okay. So sleep helps remove these proteins. Sleep really is where your brain recovers. My 6-year-old was complaining she hates sleep, she doesn't want sleep, and blah, blah, blah. And I was trying to explain to her that that is really where your brain resets, improves, grows. That's where your brain is doing all sorts of amazing things like storing those memories in places. So for yourselves or for your loved ones, try to focus on sleep. Aim for 7 to 8 hours of quality sleep per night. Address things that are affecting sleep, too much caffeine, sleep apnea. Um, when you exercise or do brain related exercises, it makes you more tired. So I've definitely noticed my daughter, if we're at home all day because she's sick, you're a bit more restless. She's often not going to sleep as well because your brain and your body are not as exhausted. I won't talk too much about supplements and brain health. Just use caution. A lot of supplements can have interactions with medications, okay? But the best thing to do when it comes to supplements is use it as an add-on therapy, okay? Nothing quite like a well-balanced diet. A lot of people, should I take a multivitamin? And I say, how's your diet? And if you've got a well-balanced diet, fruits, vegetables, fish, protein, carbs, when you eat fruits and vegetables, you're targeting different colors. You're usually getting most of what you need. But with that said, um, either for yourself, if you're worried about cognitive health or you've got a loved one, a lot of the vitamins I've listed here are pretty safe. Uh, so you've got your B vitamins. If you're not specifically deficient in a B vitamin, I don't always suggest it. However, if you do have fear of cognitive impairment or you're tired, you want to be more sharp, then I do often love B complex. So B complex 50 or B complex 100 is 50 of each different B vitamin or 100 of each different B vitamins. So B complex vitamins can be great. Vitamin D is an easy one because generally all of us should be on vitamin D. Most of us, especially in Canada, especially in the winter, are vitamin D deficient. So that is something that supports brain health and mood. Um, Low levels can be linked with memory problems or depression. If we're talking about a senior who's in the house more often, I might suggest take a higher dose during the winter months, 2,000, 2,500 units. And if you're outdoors more in the summer, you can either take a break from it or just go down to like a maintenance dose of 1,000 units. Okay? Vitamin C helps to boost your body's immune system and reduces oxidative stress and inflammation in the brain. Pretty harmless. Magnesium is another vitamin or mineral that I love. Okay, so magnesium is important for nerve signaling and learning. It's also very helpful for sleep, can be good as a muscle relaxant and help with anxiety. So, before we were talking about sleep aids, here's a great opportunity where before you jump on a sleep medication, maybe you try magnesium. Okay? Ooh, great question, Juanita. There are many types of magnesium. Which types of magnesium do you recommend for memory? Well, the main thing I like to say when it comes to magnesium is not all magnesiums are created equal. Okay, so if you come to Sparkle, everyone here knows magnesium bisglycinate. I just typed in the chat, but magnesium bisglycinate or magnesium glycinate is my favorite. Good absorption, low side effects. Okay, so magnesium often irritates the gut, can cause diarrhea, and it's not absorbed very well. Whereas magnesium bisglycinate is absorbed well, low incidence of side effects. So a lot of people have told me, oh, I take magnesium. It's not that helpful. I'm on 500 milligrams, but they're on one of the cheaper mix match magnesium options that are out there. And I truly find magnesium bisglycinate is good. Usually comes in a dose of 200. I say start with one. After 3 to 7 days, if you don't see the desired effect, you can increase to 2. Okay? As I said before, pretty much everyone in this chat would benefit from magnesium and vitamin D, plus or minus a B complex vitamin. Zinc can be helpful, helps brain cells communicate effectively. Just watch out with zinc. Sometimes it binds to different medications and interacts. Iron can be very helpful at improving the oxygen carrying capacity to the brain. However, iron is one of those medications or supplements that I don't suggest it unless you're low. So go to the doctor. If you're low in iron, take it. But I wouldn't suggest taking it if you're not low. And then the next supplement on the next page, very important as well, is omega-3 fatty acids. One of those options that we would all benefit from. So it helps to build brain cells. It's a major building block of the brain and can help keep cell membranes flexible. I like to describe these oils as a lubricant. So it's also helpful for joints and arthritis. Okay. If you can get your fish oil naturally through eating actual fish, much better. Nothing like getting things naturally. Okay. And I think Juanita's signaling me. Is she? No? I see something. Okay. I think I'm almost done.
Yeah, no, I wasn't signaling at all, Michael. No.
Oh, okay. I saw some. Okay, got it. Yeah, so I won't go into this one too much, but for the most part, by all means, supplement with omega-3 if you hate fish. If you hate fish, sometimes there are non-fishy fish oil options. Okay, you can consider that. Usually we're trying to get to about 1,000 milligrams a day. And that often, if you look at the back, is broken up between the DHA and the EPA. But at the bottom here, it shows the different sources of omega-3. So if you're not a fish person, there are plant-based options like flax seeds, chia seeds. You could easily incorporate things like that into yogurt. If you're trying to help a loved one with, calories and proteins, well, hey, you could do a smoothie or a yogurt that includes flax seeds, chia seeds, helps the bowels, helps the brain. You could add a little protein powder to that, helps to make sure they're getting their protein. Mediterranean diets are known to be very helpful in terms of fruits, vegetables, whole grains, and healthy fats, healthy oils. Here, there's something cute. Nothing beats a well-balanced diet. And that's it. Does anyone have, I tried to cover as much as I could.
Yeah.
Does anyone have any questions or comments or things that I missed or things that I got wrong? Hopefully nothing wrong.
Mm-mm.
Yes, Hillary.
I'm applauding, that's all.
Oh.
Oh God, I
That's
thought you
great.
were waving. But
No,
that's,
well, it says applaud, but
yeah,
yeah.
I'll take
Oh,
it.
thank you very much. It's been very helpful. Really appreciate your time and your expertise.
Yeah, it's my pleasure. Um, if everyone here is a caregiver, I think the most important thing to do as well is also remind yourself that it can be frustrating to care for someone who has dementia. And I've tried to remind people in my life that care for someone with dementia that you also have to take care of yourself. So if you live with somebody who has dementia, you could feel handcuffed to your life. You could feel handcuffed to the home. I know some people that, oh, I just slip out for an hour when the PSW comes in. You know, that's at least good enough that you're able to get out and give yourself a break. But if you're just running to the pharmacy to pick up something and running to the grocery store to pick up something, you know who you're not really helping? You. So you're not helping your brain. Are you exercising? Are you walking? Are you maintaining your own relationships and social activities to help prevent you from having cognitive impairment 20 years from now? You know? Or are you doing these activities that will help you to prevent getting depressed? Or are you preventing from resenting your loved one? So I find you got to remember as a caregiver to extract for yourself too. And sometimes you might be the only sibling taking care of one of your parents, and there's no other option. Maybe that's where chats could come in and help with something. Maybe that's where um, you drop a loved one off at the senior center during one of these programs. And, I was recently on vacation and we dropped off my daughters at, they had the kids club. Now, we don't want to drop them off all day long. Yeah. So see here, Paula mentioned adult day programs at chats are a great option. It doesn't have to be always, but hey, every Tuesday you go and do you. And you know that your loved one is in good hands, you know, and you're going to go take care of yourself. So while on vacation, I dropped off my kids a couple times at the kids club from 2 to 5. They just watched a movie. And my daughter said, I don't want to go. And I was like, I don't care. You're going because this is my vacation too. And, I'm going to take care of myself for a minute so that I can keep taking care of you in the happy way that you need. But I can't be happy if I'm stressed out, tired, burnt out, and that's all of us. And no matter how strong you are, life gets to you. Um, so you just have to make sure you're taking care of yourself just as much as the loved ones in your life. That's
Well,
all I have to say about that.
thank you.
You're welcome.
Very wise man. And I suggest that anybody who would like to visit Sparkle Pharmacy can easily go in and ask any questions to him or his team.
Yeah, our team is always here to help. I'm not always here sometimes because I'm doing other things,
Yeah.
like these presentations. But I assure you that my staff are all as helpful as I am. The main pharmacist that works here, Roxy, no pun intended, she's a rock star. Me and her went to U of T together, and we've been educated together, and they hold it down while I do some of these other business related tasks. And if you're not going to come to Sparkle, that's fine. What I want you to do is at least just have a good relationship with where you do go,
Where you do have your
you
pharmacy.
know? And there are good pharmacists everywhere. If you have a good relationship with where you go, then I don't want you to come here because I want you to continue with your relationship where you go. They know your parent, or they know you, or they know your loved one. But if you go to a pharmacy that gives you no service, I highly suggest you switch to anywhere that is known to give good service, because the more I get to know my patients, because we have that style here, it's easier for me to flag a loved one. Hey, what's up with John lately? He's not himself, you know? But if you go to Shoppers or Costco and you're just a number, then sometimes you're missing out on that extra little bit of service or expertise because you're a number instead of a person, you know? So very important to benefit and leverage your pharmacy wherever you go.
I also find it quite important to everybody that you switched over to a compound pharmacy, and that's hardly ever found in Richmond Hill. I think there's one, so it's kind of nice to know that you have that
Yeah.
option.
And most pharmacies don't compound.
That's right.
So you might just go to a regular pharmacy, but it's at least helpful to know what a compound is.
Yeah.
Because when the stuff off the shelf is not helping or causing side effects or causing interactions, that's where compounds come into play, is that they can be helpful to, change the mechanism of action.
Yes, and help the caregiver with their care receiver.
Yeah.
So it's an option, and that's
100%.
wonderful.
100%.
Well, thank you very much for coming, Michael. That's the end of our time. Unless anybody else has any more questions, I don't see anything else in the chat.
Thank you all. I know I kept us a little long, but I tend to do that.
Yeah, I can listen to you the whole day. I don't know about everybody else, but I can. So
if only my wife would say that.
Yeah. Anyway, thank you all for coming. I really appreciate it. Please know this is a recorded session, and all will be receiving a recorded copy by the end of this week.
Thank you all. Have a great week.
Thank you. You too.
Take care.
Bye, everyone.
Cheers.
Thank you. Bye.